We explain comfort care, which is the realm of hospice care. That's what hospice care is about at the end of life, when patient is facing life-limiting illness and there is no longer a cure, or it is no longer advised that aggressive treatment be pursued. Pain control is typically multimodal, meaning that we need to approach it in a number of ways. There's very much a specialty around determining the type of pain that a patient is having and selecting an appropriate therapy. A combination of those modalities is usually most effective, and it's not just the pharmacological modalities. We look at other non-pharmacological treatment, music therapy, biofeedback, meditation therapy, creating a certain atmosphere in the room. Of course, we are a team approach at hospice, and we have our interdisciplinary team that works to assist the medical and nursing staff in addressing all of the elements of the patient's pain. Maybe it's spiritual pain, psychological pain. But in terms of treating the physical, first we look at whether opioids are appropriate. We look at adjuvant therapy that can be combined with that to be most optimal for controlling the patient's pain. And we look at the route that will be most successful for the patient. It's important to continually reevaluate the effectiveness, so we do that really on a daily, weekly basis to make sure that what we're doing at that time continues to be effective, and evaluate whether it needs to be readjusted in terms of a different drug, a different dose, a different frequency, a different route. I think one of the things that families can expect from us when they are electing hospice services and are learning about comfort care and the realm of care that we provide is the expertise that we have in utilizing a number of medications, maybe doses that they hadn't been familiar with before, maybe a route that the medication is given that they hadn't been familiar with. I think we're different than another setting, whether that be an acute care setting or a long-term care setting, because we specialize in this role of comfort care, primarily pain, but we're also looking at shortness of breath, nausea and vomiting, anxiety, fatigue, insomnia, delirium, agitation. So really a number of symptoms that can occur at end of life. We have expertise in how to combine medications in a way that will provide comfort that perhaps are not as familiar in other settings, but are unique to what we do. And we do that in a way that achieves total comfort for the patient with whatever symptoms they're experiencing at end of life. So I think when families enter the inpatient facility or they enter into service with us in the home setting, they have a professional that has experience with this realm of care, with the multitude of options that we have available, but also the very unique individualized care that we give in treating someone's pain or other end-of-life symptoms.